Hello, sweetheart.
His name's Jacob, he's 12 and a half years old.
Okay,
This is my car here.
Okay.
The next thing I noticed was the kid.
Where did the little boy come from?
He was crossing the road there.
Okay, at the crossing.
A passerby
Quebec
has used her
450, did you
coat
say?
to keep Jacob warm before the paramedics arrived.
And he travelled on the road all the way across the road.
All right. Okay, fine.
Stopped there and...
Okay. We're going to get you warm, okay? Hey, sweetheart.
12-year-old Jacob was on his way to the barbers when he was struck by the
Jacob,
van.
listen. Jacob, my name's Annie. I'm one of the doctors. Jacob, open your eyes. I'm going to help you, all right? Are you in pain at the minute? Where does it hurt? Your head, all right, darling. So what I need to do is just look at the rest of you and make sure you're okay. You've got some grazes on your face, which is why it's sore. But I'm going to give you some medicine, okay? Are you brave? Yeah, I bet you are. You're super. He's shouting. That's a good sign. His airway's clear, and at the moment he has a high level of consciousness. But things could still deteriorate for this little boy. Under one of the legs, yeah, underneath and under that leg. Just we're going to look after you, I promise. I need to have a look at your chest. Can you take a big breath? Does it hurt when I'm touching your chest? No, good man. All right, let's look at your tummy too. Does it hurt your tummy? Just your head. All right, my love.
All right, sweetheart, you're doing ever so well. Well done, well done.
Hit by a van at 30 miles an hour, it's enough to cause fatal injuries. Could be anything from chest, abdomen, pelvis and extremities. What I'm particularly worried about is he's got a big swelling on the right-hand side of his head. You're good, you're doing fine.
The account of the accident from the driver of the van could provide vital evidence to the extent of Jacob's injuries.
I'm one of the doctors in the helicopter. How are you? And was he unconscious? And he was awake? Was he talking? All right, I just want to have a look at the front of the car, if that's all right. Yeah, so there's a dent here. He's quite little, so as to... He's 12, but as to which bit of him hit that, it's not entirely clear, but quite possibly his head. There's no bullseye to the windscreen, but you can see his body's actually scuffed. Where it's clear here, that's where his body's hit it, where the rest of the van's actually dirty. These sort of injuries are sort of fairly time critical, so the quicker we get him to hospital and get him a CT scan, see if he has got a fracture or bleed, the better. We're about, looking at it, that's St George's over there, isn't it? So it's about 2 minutes. So we'll go in the ambulance. He's got a big swelling on the right side of his head, which is probably where he's hit the van. And one on. Just listen to me, you're doing okay. We have to pop a little drip in so I can give you some good painkillers, all right? You have got a big bump to your head and I can make you feel better. Good boy. Thanks, Nick. Jacob, is that better?
A little bit warmer.
Yeah, another one.
Good boy.
Yeah.
All right, so
Okay.
on your count. Lower.
Great work. Okay. Hey, well
Good
done,
boy.
darling.
That's it. Good.
Lovely job, thank you, everyone. Okay. I might just slip his glove off for completeness. He's lovely and warm, actually. There we go. Got a 12-year-old boy. He's a pedestrian. He's been hit by a van. He's actually GCS 15, but he's likely to have a significant head injury. And we'll be with you in just under 5 minutes.
Anne is taking Jacob to St George's Hospital, a major trauma centre in South London. Crucially, it's less than 5 minutes away by road.
I'm going to shine a torch in your eye, mate. Open your eyes nice and wide.
Jacob has had a major blow to the head. It's possible he's got a potentially fatal bleed on his brain. The size of his pupils could tell them if this is happening.
They're probably about a 7 and they're quite sluggish, but they are reactive and they're equal. 7 as in large? Yeah. To be honest, you can have a head injury, you can have normal blood pressure, normal heart rate. He could still have a bleed, which is expanding now, and he just hasn't shown the sort of classical signs of that yet. But yeah, he's got a great big swelling on the side of his head and grazes on both sides, so yeah, I am quite worried about him. Jacob? Hello, darling, you okay?
38 minutes after receiving the call-out, Anne hands Jacob over to the trauma team at St George's Hospital. She's done all she can. The next 24 hours will be critical for the 12-year-old. London is protected by some of the best trauma doctors in the world.
Someone's fallen underneath the train.
From their base in Whitechapel, this elite team of medics are ready to respond to emergencies 24 hours a day. For them, every incident is a race against time, to get to the patients and unravel the clues that could save lives.
A&E London, 10 minutes.
The trauma team working overnight are bringing in a patient found very close to the hospital, a 40-something male who may have been assaulted.
We're getting ready to receive a patient. The patient's got a head injury. We're not quite sure what's happened yet. They must be quite worried about the patient because they've given the patient an anaesthetic outside of the hospital. This sounds like it potentially could be quite a serious head injury.
This is an unknown middle-aged male. He was seen to be lying on the floor on the CCTV camera, with two males seen to be running from the scene.
Okay.
On LAS first arrival, he was found on his back with a body swelling over his head, not responding to verbally, responding to pain and combative. Pupils were initially 4 and reacting to light and have been pinpoint post RSI.
Yeah.
He has swelling to the left side of his face and an extensive laceration to the scalp. He has otherwise been stable.
Okay, thanks. Well done. Okay. He was combative at the scene. This worries me. If there's blood inside the brain, then this could mean we have to do an urgent operation to remove the blood. I'm worried he may have been stabbed or assaulted with an object. We need to look at him thoroughly to check if there are any other signs of any injuries. Okay, primary survey, off you go. Chest x-ray, thank you very much.
Bilateral air entry.
And just grab some head blocks, please, people.
Abdomen soft. Peripherally warm.
Recheck when you get a minute the pupils. In a patient who's had a head injury, you can get some quite significant changes in the eyes.
There's bleeding inside the skull. The bleeding can rapidly increase the pressure inside the skull, and that pressure can squash the nerve that supplies the eyeball, and that can cause the pupil to dilate.
Because if those pupils change, then that could indicate that something fairly catastrophic is happening inside someone's brain.
Too small to get rid of. Got a nasty eye injury on this side as well.
Mark, should we get packaged up, ready to go into CT?
We've got grey on this side. Just got nothing.
That'll go off. Gareth Greer, G-R-I-E-R. Good. Thanks, Alex. We're not sure of the mechanism now, so anything could have happened. We're going to scan head down to pelvis.
It turns out the patient is a journalist called Joseph. His eye is badly damaged. Gareth will use the CT scan to find out if there's bleeding on the brain. If there is, it could be fatal.
I find this could be anything from a concussion, a severe form of concussion, just to a bleed that means going to the operating theatre pretty quickly. So that's why we're very keen to get into the CT scan as soon as possible.
Gareth has the images of Joseph's face.
There are some broken bones in his face, particularly his left eye, and we were looking carefully earlier at his left eye. And I think what's happened is that the eye socket has broken. Some people describe your face as the crumple zone for your brain. So if you think about a car having the crumple zone at the front of it, when the forces are applied to your face, the face will crumple, and that protects your brain to a certain degree, whereas if we were all sitting here with our brain right at the front, and the important bits, then the brain would take the impact. So this is the front of the head and this is the back of the head. Now the front of the head, so this is the right side of the front of the head. There's some bleeding, this white here, which is bleeding. But interestingly, the opposite side on the back, you can see a little black dot, and that little black dot is air. So what's happened is one part of the head has hit something, and the other part has had a force thrown through it, so that there's bleeding at this side, even though perhaps this side has taken the impact. So this bleeding here is significant.
With bleeding on his brain, Joseph is in a critical condition.
So I think the important thing here is that we measured the pressure inside the brain and keep an eye on that pressure, because of course this bleeding is here. There'll be some bruising underneath the bleeding, and bruising often gets worse. And as bruising gets worse in your brain, the pressure will sometimes get higher.
Joseph will now have a pressure monitor fitted to his skull. If the pressure starts to build, he'll have to be taken for immediate life-saving brain surgery.
Keep going straight at Commercial Road.
The trauma team is on its way to an emergency in central London.
Straight through the next 6 miles.
The ambulance service has received numerous calls about an explosion in a busy street.
It could be anything from, you know, someone letting off a firework, or it could actually be something more sinister than that. So it's difficult to speculate. At the moment, we probably just want to concentrate on getting through the traffic.
With the explosions, the potential for catastrophic injury is high. Anne must look for clues to the force of the explosion. Signs of damage to internal organs, indications of shock, and signs of spinal damage.
Down there, we might be best to park and walk. Red Base Medic 1, we stopped the car at High Holborn, the ETA, about 1 minute.
The London Fire Brigade has used its trucks to close off the scene of the explosion. With their kit bag weighing 13.5 kilos, the trauma team must make the rest of the journey on foot.
Hi, how are you? Anne and Andy from HEMS.
Yeah, the guy that's got the burns was just up there.
Yep.
He was being treated.
We're all right to go down there, yeah?
Yeah, yeah.
Thanks very much. Hi guys, it's HEMS. My name's Anne, I'm a doctor from the helicopter service. We're here to help you with these guys. We're going to get you some really good painkillers, okay? Guys, what do the back of his legs look like? Have you seen yet?
25-year-old workman Barry has been badly burned in a high-voltage
All the stuff
explosion.
seemed to be...
In and out.
Anne needs to look for clues that will help her work out what his injuries are as
Okay,
quickly
thank
as
you.
possible.
Someone there. Can you bend your fingers
in his back.
and straighten them out? Okay, good stuff.
Most of it was here. Try and wrap it around that.
How long's the water gel been on for?
That has just literally just been put on. The only water gel he's had on for any length of time was on his hand, because his hand was quite bad on there.
Guys, what do the back of his legs look like? Have you seen yet?
Right, I'm trying.
Okay.
All the stuff seemed to be at the front. He was stood at the front. The explosion went off in...
Okay. Let's just snip his pants off as well and check underneath. And then you're doing a cracking job there. If you carry on with that.
He was naked like this when we got there, so it was burned.
They've blown off him. Okay, yeah, fine. Okay.
So just
Does your breathe? Does your throat feel sore at all?
no,
Okay.
just really cold.
Yeah. We're going to wrap you up and get you nice and warm, okay? Guys, are we done with the cling film yet?
Just about. Just want to get a little
Okay. And do you think you were knocked out at all?
Just the flare came and I went to the ground, roaring and shouting and screaming.
Well done, you're doing really well. I can see that Barry's face has been burnt. I am concerned that he could have inhaled hot gas or smoke. I'm worried about his airway. It could get worse over the next couple of hours, which may make it difficult for him to breathe. We're okay? Now listen, you have got bad burns to your legs, and obviously you've got soot and your hair on your face. Do you have a beard?
Yeah.
Most of it's probably sort of gone okay.
November's over, okay.
Yeah. Now listen, what we're worried about, we're going to give you some really good painkillers, which is going to help a lot, but because of the burns across your face, there is a risk that your face is going to swell up, which is going to make your breathing more difficult. So what we're going to do now is we're going to give you some strong painkillers first to get you comfy, and then we're going to give you an anaesthetic. All right, Barry, sorry about this. It's going to be a sharp scratch in your arm, OK?
Despite having extensive burns to his face and body, Barry's immediate concern is getting hold of his girlfriend, Fiona.
Okay, I've left a message on her answer phone. Is there any friend or
Can you
anybody?
just please keep ringing?
I'm gonna keep ringing. Is there anybody else we could talk to?
Rory.
Rory.
Or Joe McGlynn. Or Joe.
Barry, well done. We've got it in, OK? Painkiller is going to come any minute.
How long does it take to work?
It's really quick. It's super quick. It's called ketamine. And you've probably heard people talking about using it in nightclubs and things, OK? But it's been designed as a great painkiller and an anaesthetic, OK? And you've got that flush set as well. The burns on your legs are such that we will want to take you to a burn centre. But what I'm going to do before we take you there is we're going to pop you off to sleep. A, so you're not in any pain, and B, so that if your face does swell up, we've actually got your airway secured, OK? We're going to do that, and you're going to feel a lot better, and the pain's going to go away. All right?
Yeah,
OK, darling.
Keep lamps ready.
Good.
I'll bubble wrap and scoop outside.
Can you feel the effect of the painkillers at all? Not yet. Do you tell me honestly?
My toes are absolutely frozen.
OK? All right.
Anne's worried that the burns on Barry's face will make his throat swell and stop him breathing. She needs to put him to sleep and take control of his airways. It's a risky procedure, and space is needed to perform it properly.
So guys, can we
having
just
a
check
reaction
everyone's
to
happy
the
with what we're
ketamine.
doing
He
and why
needs
we're going
more
to
to completely sedate him.
Oh my God! Okay, just try and relax. Keep your head down.
I'm relaxed. Oh, Jesus Christ!
Now Barry is finally sedated. Anne can start the procedure to put him to sleep.
60 seconds, he's up now, he's probably
Okay, let's go. Got a laryngoscope? Yeah. Just want to move him this way a bit. Okay. Can you do that? Grade 2. Bougie, please. Thanks. Okay, bougie through the cord tube, please.
I have the bougie.
I've got the tube. Okay. Tube through bougie out, please. Move him. Okay, you're doing a great job. Now, it's all right.
Temperature probe.
In fact, I wonder, should we just get going? Because actually he's not that... We've got to move him when we get there. We've got to put him on the scoop anyway, so let's just do it. Yeah.
Anne has control of Barry's
Can you check
breathing.
this, Paul, this esophageal probe is going to get caught at the top? Gentle, gentle, gentle. Okay, great. And then some tape over the top. Perfect.
He could have been thrown to the ground by the force of the explosion. So before he goes to a specialist burns unit, Anne is taking him to the Royal London Hospital to be checked for potentially life-threatening internal injuries. Anne is still looking for any other clues as to what happened to Barry.
So did you get a clear story of what's happened?
Basically, he was doing some sort of roadworks, and all he said was he saw a massive ball of flame, and that's the only thing he remembers about it.
Okay. Okay, we're bringing you a patient by land, 25-year-old male who's sustained facial and limb burns. He was GCS 15, but has been intubated and ventilated for potential airway compromise. Cardiovascularly stable, and we'll be with you in 10 minutes. At this point in time, he's relatively stable, but you can go into multi-organ failure from burns, so hopefully we've done the right thing for him.
Multi-organ failure can be catastrophic. It can kill a person within days. The trauma doctors from the Royal London Hospital and London's Air Ambulance are on call for emergencies 24 hours a day. This elite team of medics are always on the lookout for clues that will help them make the right diagnosis. They have to make on-the-spot, split-second decisions that can mean the difference between life and death. Barry's on his way to the emergency department of the Royal London Hospital. He's been badly burned in an explosion. The team needs to find out if the force of the explosion has caused potentially fatal internal damage.
We know that the patient has got some burns, but we believe there's been an explosion, which always adds a little bit of mystery to what might be going on.
Andy, you want to take the tube?
A straightforward burn or a flash burn is usually something which is fairly superficial, but if there's been an explosion, then there may be all sorts of injuries.
Alistair will need to work quickly to look for the clues that could point to internal injuries.
This is Barry. He's a 25-year-old man. At 12:43, he was in High Holborn. A big flash, explosion, flash of light. Doesn't think he lost consciousness. His clothes were on fire, particularly around his legs. LES have had to cut his jumper off. Injuries from top to toe are he's got extensive soot around his face, facial hair singeing of his eyebrows, nasal hair and his beard and moustache. He's got mixed superficial partial thickness and full thickness burns to his hands and his anterior legs. He's got up to 36% total body surface area. He's had 500 mils of fluid through a fluid warmer and his temperature is 35.4 despite bubble wrap. So in summary, electrical injury with about 30 to 36% total body surface area burn.
Right, thank you. Can we undo top, undo bottom, ready for out? I'm concerned about this patient. He may have other injuries because we know he's been involved in an explosion. Injuries to liver, spleen, inside the abdomen. We have to establish what sort of injuries he's got apart from his burn. What temperature is it outside at the moment? Do we know?
It was -1 about an hour ago.
Let's leave the bubble wrap on, okay? Right, hands over from right to left. So chest, X-ray and pelvis, if you would, thank you. Can you write down, moving head and neck freely at scene, GCS 15, Alistair Wilson has cleared neck.
Okay, X-ray.
Yep. Okay, 5, 4, 3, 2, 1, go. The handover is quite useful because we know that his head and neck's fine, so we don't need to worry about clearing the neck, which, you know, that would have taken a significant time for a CT scan.
An X-ray also reveals Barry's chest wasn't damaged in the explosion.
Perfect. Good. Good. I mean, how long, or at least what was the time at which the accident happened exactly about? Or do we not know? 12:43. He's behaving very stably, and it's been some time since the incident, so we know that it's unlikely that there's any blood loss.
It seems Barry has escaped life-threatening internal injuries from the explosion, but he has second and third degree burns to a large part of his body.
How much did he have fluid-wise on
Only
there?
500 mils.
Fluid loss from Barry's burns could cause multi-organ failure. Alistair needs to replace the fluid quickly.
I think his estimated weight must be 110.
So we need to give 8.8 litres in the first 8
8
hours.
hours, that's right.
And we're on to 3 litres. So we need to give a total of another 5 litres on top of this, plus maintenance.
The skin, people forget, is a very big organ, and it, after a burn, you lose a lot of fluid into the tissues round about, and the skin ceases to work the way normal skin does. Now, we have to counter for that, and we do that by calculating the amount of burn fluid loss, and then we give it back to him over a period of time.
With Barry's fluids now at a safe level, Alistair wastes no time in transferring him to the specialist burns hospital.
Can I have your burns registrar that's on duty for today, please? The patient he's got partial thickness and full thickness burns going up anteriorly and partial thickness posteriorly to both legs, right up to the genitalia.
The specialist burns unit at Broomfield Hospital is 65 kilometres by road.
Yes, good. We're ready to go, I think.
Barry's burns are so serious, Alistair is having him transferred by helicopter.
Well, we just need to keep him asleep, and we need to keep his blood pressure stable and ensure that he's ventilating properly. All the usual things you'd worry about inside a hospital.
we've got a patient coming in by HEMS who's a motorcyclist, apparently with a suspected femoral fracture and possibly a pelvic fracture. So he may have other injuries as well, but that's the information we've got so far.
A 46-year-old biker was on his way home when he was involved in an accident with a transit van.
This is Don.
Okay. Right, so we'll get him across first and we'll get the hand over. Okay, you happy at the top end there? Okay, let's listen up.
Okay, Don's a 46-year-old motorcyclist. He's been travelling down a road. A white van has pulled out from a junction and he has T-boned the van to the driver's door. He's been thrown onto the bonnet, dented the bonnet, bullseyed the windscreen, probably with a body part rather than a head, and then over the top onto the ground, landing on the road next to the van.
Bracing to the patient's left, on brace, ready, steady, brace.
Damage to the motorcycle was the front suspension has gone, the front part of the seat has been pushed forward and lost, and there's been a small indentation to the fuel tank as well. On our arrival, he was GCS 15 with full recollection of events. He was moving all his limbs. Injuries from top to toe. He has a possible pelvic injury and proximal femur, maybe subtrachyteric. And he's had 12 of morphine for pain relief. He's had no volume issues, he's been very stable en route, and he's not known to have any allergies or past medical history.
Okay, and let's crack on with the primary survey, please. The surgeon's doing a primary survey, which is a rapid clinical assessment to look for life-threatening injuries in the first few seconds. Really looking for anything we need to do immediately to stop the patient deteriorating.
90, no recorded blood pressure yet. Abdomen's non-distended. Soft. Check the pelvis. Pelvis in a binder. SI joints are equal bilaterally.
The bike's been pretty badly damaged. He's quite likely to have spinal fractures, bleeding, mainly from within the abdomen. And of real concern, there's some indentation to the fuel tank, which could be caused by his pelvis hitting that fuel tank, and any pelvic fracture can cause quite serious internal bleeding.
Blood pressure. 151/92.
Okay, thank you.
Equal air entry by, equal pupil reactivity at 2 mils.
2 mils, okay. So chest and pelvis x-ray then, please.
Okay, chest x-ray, day 85.
How are you doing here?
Thank you. Oh, no, I'm bringing it back.
So x-ray's done, let's have a look at that. That was... Okay.
How's it going?
Everything looks quite stable. I'll have a look at him and see where he's sore then. Just, okay. Hayley, has he got a lot of pain now?
Left leg and right hand are his main pain.
Okay. Can we get him some morphine, please? Hi, John. My name's Simon. I'm one of the consultants at A&E.
Yeah.
How are you doing there?
All right.
Where is the worst pain?
On the left leg.
And whereabouts in the top of your left leg? Okay. Because we couldn't see anything broken on the x-ray of your pelvis, which shows your hip joint.
Okay.
But we're going to just x-ray the whole of that thigh bone just to see if there's anything else that's causing that pain there.
5, 4, 3, 2, 1. Stop it.
What we see on the x-rays is he's got a fracture just above his knee, just on his what's called the femoral condyle. It just goes to show that pain can sometimes be felt in areas away from where the actual abnormality is. We know that people often feel pain from the hip joint within the knee. In his case, he's experiencing the pain that's arising from a fracture, essentially in his knee joint, up in his thigh and towards his hip joint. Okay.
No, 2 ready to speak with your scans. Are you going to chat with them?
There's a bit of ache in that left space, isn't he?
Okay.
It's certainly much more opaque on the other side, even if you look at the periphery. He's got some increased shadowing of the left side of his chest. Could be a sign of serious bleeding inside his chest. If not bleeding, bruising of his lung. Either of these things can be potentially life-threatening. All right, guys, we go to CT then.
Simon needs to get Don to the CT scanner. He's hoping it'll reveal the cause of the worrying shadow on Don's lungs. It will also show up any spinal damage caused by the crash.
So what we're going to do is we're going to move the side away from the
Yeah.
scanner. But we don't want you to move, okay? We're going to do some movement for you.
3, 1, 2, 3. Cool. You're going to keep your head nice and still, yeah? So part of the scan we're going to do is give you an injection of hot X-ray dye, okay? Through the cannula in your arm.
Simon's injecting Don with a special
Have we got
dye.
any transport tape or something?
It can detect even the smallest amount of internal bleeding.
Okay. Happy? So that's...
Simon's just noticed a change in Don's oxygen level.
Don's oxygen level just dropped. And that's not a normal response for someone with healthy lungs. I'm getting increasingly concerned that he has got an injury to his chest which has caused bleeding or bruising of his lungs.
Breathe in and hold your breath.
Alistair has joined Simon to analyse Don's scans.
We've got the head and neck come through first. It seems to be okay. Yeah.
The scans show that Don's neck isn't damaged, but with the shadow in his X-ray and low oxygen levels, there's still a concern about Don's lungs.
The CT scan doesn't actually show any bleeding around the lung or any real significant bruising of the lung. Like anybody who's been lying flat on the back for some time, he's got some what's called dependent changes where a little bit of fluid accumulates in the back of the lungs, but it's nothing particularly that explains my initial concern.
So that's good.
Despite having collided with a van, Don's most serious injury is a fractured knee.
Don, I've spoken to Mum, okay?
Yeah.
So she knows that you're here and everything, and I'm going to get the phone in a minute and you can talk to her herself. I'm sure that'll reassure her. Okay.
I had a look at your CT of your neck and it looks fine. I can't see anything broken there. So what I want to do is I'm going to take the tape off here. Again, don't move. I'm just going to take the collar off. What I'll do is if I sit the trolley up a little bit to start with, you tell me when you want to stop going up, because it can be a bit of an odd feeling as you change from being completely flat. I think you better stand up on that leg at the moment, or either the legs.
I've got Don here. I'll let you have a little chat.
Hello. Yeah. I think I'm all right. My leg's killing me, but I don't think it's bad.
In the context of the injuries that he could have sustained, he's got away very lightly, and it's interesting working through the whole process to work out what's wrong, but at the end of the day, the best result is if there's nothing terribly serious and something, the only things that he has got, you expect him to make a full recovery from, so that makes me pleased for him. I'll say bye then, Don. Take care. All right, all the best.
Cheers.
We're going to report to an explosion in the street. It could be anything from, someone letting off a firework, or it could actually be something more sinister than that. You have got bad burns to your legs. We will want to take you to a burn centre.
We know that it's unlikely that there's any blood loss. He's got a flash burn. He's got about 36% burns involving his legs, hands, and face.
Barry spent 12 days being treated at the Special Burns Unit at Broomfield Hospital. He has to have regular checkups for his burns, but is recovering at home.
It sounds like Barry's recovering physically quite well. There's obviously emotional and psychological effects from being burnt as well, and we wish him the best and hope that he makes a good recovery as soon as possible. My name's Anne, I'm a doctor from the helicopter service. I think when you go to burns patient, you do
You often put yourself in the patient's position, actually, because I think burns are something that we accept as part of everyday life. I think people are always wondering what's going to happen from a cosmetic point of view, whether they're going to be disfigured or scarred. It does have a real human pull on you, actually, and you try and get their pain under control as quickly as possible so that you can deal with the other issues. Having seen Barry on the day of his injury when he was covered in soot, badly burnt, in pain and quite frightened, it's good to know that he's now making a good recovery and that hopefully we've contributed to that along with the burns unit at Brimfield.
This is an unknown middle-aged male. He was seen to be lying on the floor on the CCT camera with 2 males seen to be running from the scene.
And pupils, when you get a minute, just recheck when you get a minute the pupils.
Got a nasty eye injury on this side.
If those pupils change, then that could indicate that something fairly catastrophic is happening inside someone's brain. We get packaged up ready to go into CT. This white here, which is bleeding, is significant.
Joseph spent 3 weeks in intensive care after his incident. Despite the bleeding on his brain, the pressure in his skull did not rise enough to warrant surgery. He has had facial reconstruction to fix his eye socket and is now back home.
It was a very gradual process. I've been back to the approximate area where I was attacked. Mainly to see if it would jog a memory. It didn't, and I wasn't bothered by what I saw because I couldn't quite picture it. You know, it's like watching a film in which you're supposedly the lead actor, but no one's giving you any good lines. All my colleagues at work were intensely worried. They really have a sense of looking after their own. And they know that they could have been in a similar position. It's not so much that I'm boundlessly optimistic. It just doesn't make any sense to be pessimistic.
Jacob, my name's Annie, I'm one of the doctors. Jacob, open your eyes. We've got a 12-year-old boy. He's a pedestrian, he's been hit by a van. And we'll be with you in just under 5 minutes. So when you're tasked to an incident involving a child, you're slightly anxious from the word go. Although I don't have children, I do know plenty of children, and it does make you feel anxious for them. You're trying to provide tender, loving care, if you like, as well as medical care, and really look after that child as though they were your own.
Despite having been hit by a van and thrown over 20 metres, Jacob escaped with just a minor head injury that needed no further treatment. He was sent home a day later. It's 11 weeks since Jacob was discharged from hospital, and as a special treat, Anne's invited him up to the helipad to see the helicopter.
What we'll do when we get up there, we'll see how many landmarks you can spot.
Maybe I'll see my house.
Yeah.
Hello. Hi, Jacob. I'm Annie, one of the doctors. Nice to meet you.
Hi, Jacob. Nice to meet you.
So how are you feeling?
Much better.
Are you? Good. And from the injuries you had, is everything getting better now?
Yeah, just getting a few headaches, twice as worse, but yeah, much better.
Okay, good. So do you want to have a look at the helicopter? Yeah. Have you seen a helicopter before? No.
This is the steering stick that makes us go faster or slower. You just see some of the lights come on there. What do you think? Bad,
confusing.
Yeah.
But good.
It's a very special job working for London's Air Ambulance, and actually when we get the privilege of the patients actually coming back to the helipad, it really just brings it home to you how important the service is. How's that? Feel like a pilot?
Yeah.
Or a doctor? Yeah?
It's hard to hear though.
To see a little boy who we were actually really worried about, I'm completely back to normal. It's just very special. It's good to meet you, mate. Should we help you down? Yeah. You look after yourself, right? No more getting knocked down, okay?
Good to meet you, Jacob. I'm glad you're feeling better. You take care of yourself.
And let us know if you want to come and visit again, okay? And we'll see you when you become a helicopter pilot, yeah? All right, come and work for us.